So today we are going to talk about one complication of subarachnoid hemorrhage, which is called delayed cerebral ischemia, and simply we called it DCI. When a patient having subarachnoid hemorrhage and the bleed is occurred in body led that vasoconstriction of other blood vessels. So like if this is the blood vessel is supplying to the brain, now this vasoconstriction is occur in this blood vessel, the blood flow to the brain is going to be reduced, because of which the vasospasm, the patient can lead to vasospasm induced infarct, which is called delayed cerebral ischemia. So whenever the patient having subarachnoid hemorrhage, we add two drugs to protect the patient from vasospasm or to protect the patient from delayed cerebral ischemia, which will lead to the focal neurological deficit like the weakness, aphasia, slurring of speech from the disability. So for that we add nimodipine 60 mg 4 hourly and fletal which is 100 mg for BD. Both of these drugs we give for 21 days, because the chances for the delayed cerebral ischemia to be occur in subarachnoid hemorrhage, the chances start from first week till third week. So we will give the nimotop and fletal for 21 days to protect the patient from vasospasm or to protect the patient from delayed cerebral ischemia. Whenever the patient having delayed cerebral ischemia and DCI, the patient will be having focal neurological deficit in the form of weakness, aphasia, slurring of speech. Now what you have to do, you have to advise MRI brain with MRA, okay, and then we will check an MR angiogram. We will see which blood vessels is going to be compromised, and MRI brain we will see the stroke, ischemic stroke. Like this patient, this is the MRI. Now when the CSF is black, this is actually DWI. So on the DWI sequence, the CSF will be black, but the stroke will be white, I mean hyperintense. Now if you look at this side, you see this is hyperintense, this is small infarct, this is hyperintense, this is hyperintense, this is hyperintense, this wide, this wide, this wide, this and this. On this side, both sides you are getting the ischemic infarct on the territory of anterior cerebral artery in the form of hyperintensity, and the small infarct you see as a white. So these patient having delayed cerebral ischemia, and if you look at this side also, you see this hyperintensity is this. So this patient having a small stroke because of the vasoconstriction, vasospasm induced infarct, which we can call delayed cerebral ischemia. Now what would be the treatment? The treatment, now if the patient having vasospasm is occur or the patient having delayed cerebral ischemia, then the treatment will be Milirinone 2 gram per hour IV for 3 days. If you guys can see here, this is the Milirinone. This is the Milirinone, and this one ampule contain 10 ml, and 1 ml is equal to 1 mg. So we will put this 1 ampule, which is consisting of 10 ml of Milirinone in 100 ml burette, and this 100 ml normal saline. We will put the 100 ml normal saline in this burette, and also 1 ampule of this Milirinone injection, and then we will give IV at the rate. If you want to give 10 ml of this in 1 hour, then it's mean that you are giving 1 mg of Milirinone per hour. If you want to give 2 gram of Milirinone per hour, then you give 20 ml per hour for 3 days, okay. And we will also add normal saline IV at the rate 100 ml or 150 ml per hour. And if the patient BP is not getting high from 140, then you can also add inotropes like noradrenaline, because we have to keep the BP more than 160 and less than 200, okay. So this is the Milirinone which we give for delayed cerebral ischemia when the patient having delayed cerebral ischemia. Thank you.